Mental health apps today are stuck in a binary. On one side, you have clinical tools designed for people with diagnosed conditions. On the other side, wellness apps for general self-care. Nobody has figured out how to intelligently blend the two, so a single system can provide clinical support when you need it and lighter wellness content when you do not. This study uses reinforcement learning, a type of AI that learns through trial and feedback, to build a digital health system that does exactly that. A contextual bandit algorithm selects journaling prompts from both clinical and wellness repertoires. Think of it like a DJ reading the room. The AI observes how you respond and adjusts what it offers next based on what seems to help you most. In a 4-week study with 38 participants, the reinforcement learning optimized sequences showed something unexpected. The biggest benefits appeared after the intervention period ended, not during it. The AI planted psychological seeds through carefully timed prompts that continued to grow after the study was over. Meanwhile, participants who received constant clinical interventions experienced burnout and started disengaging from the app entirely. Here is the insight that I think really matters for digital mental health. The AI learned to modulate its own intensity. When someone needed deeper clinical support, the system leaned in with more structured therapeutic prompts. When they needed lighter wellness content, it backed off. That dynamic personalization prevented the dropout problem that plagues nearly every mental health app on the market today. The honest caveat, 38 participants over 4 weeks is a small study by any standard. The delayed benefits finding is intriguing, but needs replication with larger groups over longer time periods. And I should note that this paper is an AR14 preprint accepted at an ACM workshop. It has not undergone the traditional peer review process that published journal articles go through. If this kind of mental health AI research is useful to you, like and subscribe. We cover the full landscape of healthcare AI, including the emerging work that could reshape how we think about digital mental health support and patient engagement. The full episode is on the channel.